all comfortable? Wanted to learn about healthcare delivery system in India. Okay, so India is very vast country. So you must have seen before you are coming here. Understand? So and healthcare delivery system is also huge. Understand? So if you see the India. So I have made this slide for you. What is the difference between India and Japan? Understand? So India's population is 740 million and Japan's population is 123.6 million. So there is a huge difference. We have almost 6 to 7 times more population. Understand? And what is in India problems with the population density? We have a crowd of population. In Japan, that much crowd is not there. Okay. So life expectancy at birth in India is 67.74, whereas in Japan, life longevity is more. Is on an average, people of the Japan lives 83 years. The India is slightly lesser than that. Okay, because maybe the environmental conditions, the financial conditions, health services, that all matters. Okay, leading cause of death in India, cancer, heart disease, and cerebrovascular diseases. And in Japan, CVD, accidents, not accident should come to India. Diabetes, cancer, respiratory diseases. These chronic diseases are more in Japan as well as in India. As even the Japan is also the aging country. There are a lot of people who is having the more age. Maybe 70, 80, 90, 100 are more in Japan. In Japan, 30% of the population is aging population, more than 70, 80. But in India, young population is more. We have almost 65% population, 65% young population, less than 35 years of age. Okay, so population characteristics, the fastest young population is more and faster growing, whereas aging population is more in Japan. Okay, insurance, only 5% people in India are insured, only 5%, whereas Japan, all people are having the health insurance. So that is major difference. So the Indian population is more rely on the government. Okay. And the preventive care, primary, secondary, tertiary care measures are used in India, whereas primary and secondary preventive community measures are maintained at the Japan. Okay, so this is what. So if you see the health services are divided into public sector and private sector. Public sector is government, free of cost, no cost to the population. But private sector is a cost. We have to pay and get the services. In the public sector, we have a government hospitals, which are 1,000 to 2,000 bedded hospitals. District hospital, little bit less, 500 bedded hospital. Sub-district hospitals, rural hospitals, maybe 50 to 100 beds. And community health centers, these are very smaller. Primary health center, sub-center. So this is what government sector. Is all free services, right from the sub-center to the government hospitals. But in the private sector, we have private sector hospital, corporate hospitals, which are 500 to 1,000 bedded. Multi-speciality hospital, like our own hospital, SUHRC, you are visiting tomorrow. That is a multi-speciality hospital. Nursing homes, quite smaller, 50 bedded. And then the clinics. private clinics of the physicians or surgeons. So like this private sector and government sector means all health services in India is given by these two major sources. Understand? So this is what. And for that matter, we have a health planning at the central level. We have a central government, state government. Central is more. Okay, so there is a planning commission which is established in 1950. India has made independence in 1947 and we have started the planning in the 1947, but our planning commission has established in 1950 and it is up to the 2014. After the current government, the Modi government, central government has came into the place. So we have transferred this. Another institute is developed that is called National Institute of Transforming India, NITI, which is established in January 2015, which is having the wide scope. Okay, and then that is emerged as a think tank. Think tank. It is a cognitive thinking or intellectual people have included in that particular NITI Ayog, which is called NITI Ayog. Understand? Which is planning. Okay, so there are huge amount of finance is involved in that. So that finance is organized by the NITI Ayog, which is came as a think tank for the Indian development. So then our health sector has been divided into various subsectors. That is water supply, control of communicable disease, medical education, medical care, public health services, family planning, and indigenous system of medicine. Like this, we have a very subsectors. Understand? Under that, we are working. The Indian government is working under that. Okay. So, what is the healthcare delivery system? See, we have a diverse population. There are my children, there are young people, young women, young girls, old age peoples, middle age peoples, all are included in this. And this entire healthcare delivery system is a mechanism that provides services that meet healthcare needs of the individual, families, and community. We don't treat as an individual. It is an individual, families, and communities. Because once individual is suffered, then entire family is suffered. Because here we have a lot of people in the house. There is a crowd in the house, in the outside the house. Okay. So what is important in the healthcare delivery system? See how healthcare system is developed in India. See, first we have to see health status of the people. Health status, whether they are healthy or unhealthy. Understand which type of diseases they are suffering from. Then we have a health problems like we have seen in the first slide. There are cardiovascular diseases, there are cancer, there are respiratory diseases, there are infectious diseases. Lot of problems are there in India. So that we have to see first. Then what are the resources available? What are the resources? There is a government sector, there is a private sector, there is an indigenous sector, there are a lot of philanthropists which are working for the health. So they're all are resources for the Indian people. And what services we are giving? We are giving services through the public sector, private sector, indigenous means all this Ayurveda, homeopathy, Unani, Siddha, all systems are included in the government sector. Understand? Then how we can evaluate, how we can monitor that we have to see whether people health status is improved, whether vital health statistics is improved, like a mortality rate, morbidity rate, children death rate, old age death rate. That we have to see for the whether our services are proper or not. So this is what the healthcare delivery system is. These are the basic fundamentals of the healthcare delivery system. Okay. Then if you see India, India is a very sovereign country, includes all the things east, west, south, north, central. There are a lot of, and which is divided into 29 states and 7 union territories. These in India, if you see, there are 36 components, 29 plus 7. So these are the small states and the union territories. Okay, and we are here in the Maharashtra and Pune. Okay, so we are very vast of areas, and every state is having the independent healthcare delivery system. Every state means there are 36 units in entire India. Okay, so what healthcare delivery refers to organized provision of medicine is what they do, what India do. They are giving the medical services to individual and communities for the access to the necessary care, prevention, education, and rehabilitation services. So what is important here? The public health is important, maintaining the public health and improving the quality of life. That is our motto. We have to give the public health. Means we have to consider each and every one in the country. We have to consider and we have to plan the healthcare services. And what are the objectives? Objectives are integrated system. Means we use all type of systems. Maybe the modern medicine, maybe the Ayurveda, maybe the homeopathy, maybe the Unani, Siddha system. Understand? So all systems we are using. Okay. So how we are now? This is the India. This is the Indian government. Okay. So India is divided into various states and union territories. And what we are doing? So this is the central, and entire health system is divided into 3 components, 3 main links. One is the central, so entire India. Then there is a state. It is a state. This is a Maharashtra. Same map is here. This is a smaller unit, 1 unit. Okay. And then local and peripheral. Out of that, now Pune is here. And that map is here. Again, the Pune is divided into several units. That is called villages. Understand? So we are distributing so that every person of this, now we are here, Kolshi. Understand? So from India to state to local, peripheral, and we are here. Understand? So this all health system is divided into the 3 main links. That is the central, state, and local. Okay, you understood? Is there any doubts or any questions? You are getting each and every one, or you are not understanding? I'm little faster. Shall I go slow?
One question.
Yeah. Local and peripheral. Local means now the central to state is this one, and again
In Japan, the one hundred population in the area local. In India, area or population.
yeah, that I'm coming now. I'm coming in the next slides. Okay, so now the what central government is doing. Okay, so central government, so it means in the Indian government, what their responsibilities, their policy making and guidance, international health relations, medical and public health, drug control, food safety, establishment and maintenance of drug standards, medical education and research, national health programs, coordination with the state and other ministries for the promotion of health, census collection and publication of statistical data. This is the role of the central government. So what they are doing is the policy making. Major role of the government is the policy making and giving the funds, finance, supplying the finance to the states. So that is main function. So, and this central level organization is divided into 3 departments: Department of Health, Department of Family Welfare, and Department of Ayush. And what Department of Health is doing? Department of Health is doing policy making, coordination, medical and public health, and drug control and food safety. This department looks after the family welfare, this family planning, the care of the family members, that all, and training and research. And Department of Ayush is Indian system of medicine, in which Ayurveda, A is Ayurveda, Y is Yoga, U is Unani, S is Siddha, and homeopathy. That becomes Ayush. Ayush, the literal meaning is life. Ayush means it is a Sanskrit word. Ayush means life. So this all systems are implemented in India. Okay. Okay. And now what they are doing? The policy making, I already discussed, planning and guiding the health initiative and evaluating health program. These are the 3 main functions of the Indian government. One is the policy making, second is the guiding health initiative, and third is the evaluating health programs. Is whether that program is going properly or not. So that monitoring, evaluation is done by this central government. Okay. Now we are coming to the state. This is the state. Okay, this is the map of the state. 1 unit out of 36 units, the 1 unit is the 1 state. Okay, and again in the state also there is a ministry, State Ministry of Health. State Ministry of Health, and that State Ministry of Health is divided into 2: Director of Health Services and Director of Medical Education. This health services is different and education is different. Understand? In this also there is, then nursing is included in this, and all the hospital services are also included in the medical college. But this is the 2 departments, and what their functions? They are giving the medical services, prevention of communicable and non-communicable diseases, then immunization, vaccination, then there is a MCH care, that is maternal and child health care. So right from the maternity to child care we are giving health education to all the people. Then implementation of the geriatric care, because Indian population is also aging population, so we are giving the geriatric care. Then we have started now newly that wellness services, these health promotion services. So that also included, and the referral services, and the diagnostics, investigations. So that all is controlled by the state government. Okay. So now from central we have come to the state. Now from the state we are coming to the district level, local level, or peripheral level. Understand? So now, what question you have asked? We have a 707 district in India. That is a small portion. There are 700, maybe it must have been added a few more, but 707 district in India, and district is very wide and populous. It is very wide. It is distributed widely. Okay, and there are 6 type of division for the administrative purpose. Again, these are divided into 6 divisions: rural and urban. Okay, and all includes heads of the panchayat committees. So that district level is. So district level, how they have distributed. This is the rural area and this is the urban area. So what rural area, how it is a taluka. There are 200 to 600 villages in each tahsil or taluka. District is divided into various talukas. District is maybe having the 10 to 12 talukas. Talukas is a smaller unit. Okay, and under the talukas there are 200 to 600 villages. Okay, and then again taluka is again subdivided into community development blocks. So which is a 80,000 to 1.2 lakhs population. Is 80,000 to 120,000. There the population. Then the municipalities and corporation, then villages and panchayats. Okay, and in the town area there are 5,000 to 10,000 population, and in the municipal code more population, 10,000 to 200,000, and in the corporations it is a 200,000. Okay, so this is the district level. Okay, now so our major focus on this area, district and villages. If all the district and villages are given the proper health services, then entire country will get the health services. So district is we are focusing more on the preventive and curative services. Preventive, curative, rehabilitative services we are providing. Understand? So, and unified health authorities in each district. Unified means the staffing pattern or health services are uniform across the India. Understand? Because it is funded by the central government. So they maintain the uniformity. Say how many doctors, how many nurses, how many technologists, it is decided. And according to that, all districts, 707 districts, they are supplied with such a manpower. Okay. Then as per the needs of the population, our services are the needs of the population. If suppose if any epidemic comes, immediately the strategy will be changed. And whatever the things are required, isolation or giving the drugs, giving the vaccines. So it is a need-based services are given to the population. Then district health centers are established to monitor progress and services. Means there are sub-centers are there which monitor, which evaluate whether we are going properly or not. So that has to be seen. Okay. And Panchayati Raj is a three-tier structure linking to the villages to the district. So there is again three-tier structure in the villages. So there are again three-tier Panchayat, which is called as the Panchayati Raj. Okay, we'll see that. The Panchayati Raj, which is at the village level. Okay, so Panchayati Raj is again a three-tier structure, which is also called as a rural local self-government. Means they are managed by the people, for the people, by the people. Means the people from the villages only come up to help the other people. So that is called a local self-government, Panchayati Raj. So which is called as the structure of PRI. Panchayati Raj Institute in India is having the three types. One is the district level, very large level, which is called as a Jilla Parishad. Block level, it is called as a Panchayat Samiti. And third, village level, it is a Gram Panchayat. Understand? See how these are the people are coming together to help each other. Understand? So these are the Panchayat Raj. Raj is governance. Raj means governance. Panchayat means collection of the people together. Understand? So, okay. So again, the health sector, see, again there is a public and private that we have already discussed. Okay. So entire healthcare system now, whether it is a public sector or private sector or the central government or state government, we have a tertiary care hospitals, which are big hospitals. Maybe the government hospital and private hospital. This which is a free of cost. This is on payment. Okay. Then there is a secondary care hospital, little bit smaller, maybe 400, 500 beds hospital. Again, this is a government hospital. because there is a lot of crowd of the people will come because it is a free of cost, and because the Indian population is majority population is a poor population, their income is very low, so government is providing the services free of cost. Okay, and then the family health centers, that is a community health center, which is again smaller one, and this is a primary care hospital, very remote area. Tomorrow you are visiting that remote areas where the primary health center is there and sub-center is there. Again, this is a smaller villages. You understood? So, tertiary care, secondary care, and primary care. Primary care means which is a near to the people. Understand? And primary care, this is the first contact of the people to the health center, health services. This is the first contact. Okay, and if suppose if not treated well here, they can go this center. If not treated here, then they can go to the secondary care hospital. And for the major illness like a cancer or heart disease, they have to come to the tertiary care hospital. So in that way, it is managed. Okay, so in the rural India, rural care is also very important here. Rural care. So rural care is a primary health center where there is a 30,000 to 40,000 population. So you ask, no, under primary health center, 30 to 40,000 population is covered. Maybe 10 to 20 villages will be there. Okay, so then the community health center is there. If suppose there are certain facilities in the primary health center, might be there will be doctor, there will be nurse, there will be medicines. But for the major operations or something more disease patients, they go to the community health center. If in the community health center, there might be the physician, surgeon, gynecologist, child health specialist is there in the community health center. Okay, so then the community health center is then we'll go to the emergency centers. So which is at the district. Okay, so how the rural health infrastructure is maintained? Rural health infrastructure is the main focus of entire healthcare delivery system. Understand? So here we have got the 3-tier health system. Understand? Tertiary, secondary, and primary. So here we'll go to the primary community health center where the patients are treated, and these are the primary health center. Understand? Where the patient comes first. Okay. Then we are going to the sub-center. Now you are asked the question. No, sub-center. Sub-center is very remote area where only 5,000 population will be there. Okay. So sub-center acts as the first point of contact in the rural healthcare system. It is the first contact. Understand? And they deliver basic healthcare services. Basic, like if anybody is having cold, cough, fever, so that is treated in the sub-center. Understand? So, and in the sub-center, there are two main manpower. One is the Anganwadi workers. Anganwadi means it is a pre-nursery in the villages. That is called as the Anganwadi. Okay, and there is another cadre of the health professional that is called as the Asha worker. Accredited social health activists. These are the two main healthcare professional in the rural area, which helps pivotal running bridge the gap between the communities and health services. Understand? People and the health services. They just bring the people to the health services. They will just accompany them to the health services. Okay, and there are the following schemes in the operation. Asha scheme, which is very important. These are the Ashas. This Asha is helping the this community people. Okay, and another one is the ICDS scheme, Integrated Child Development Scheme. So integrated child development means smaller less than 5 years of old children are treated in the Anganwadi. Okay, and all the services are free of cost, no cost at all in the villages. It is governed by the government. It is given by the government. Okay. Now, so this is the how the population and how much population, and for this, see, these are the community health center. There is a primary health center and there is a sub center. Sub center population 5,000 population for the plain area, and 3,000 population for the hilly, tribal, and difficult area. If the hilly area is there, if tribal area is there in jungles and forests and all, so there only 3,000 population is covered under one sub center. This is main basic component of the healthcare delivery system. Sub center, Anganwadi workers, Asha worker, and auxiliary nurse midwife. There is a one nurse also in the sub center. Okay, so this is the sub center. And in the primary health center, there are 30,000 population, maybe 10 villages, 12 villages. In the plain area, 30,000, and in the hilly or tribal difficult area is 20,000. And in the community health center, in the plain area, 120,000 population in the plain area and 80,000 in the tribal area. So like these centers, these are the sub centers which the nurses and Anganwadi workers are helping the community people. So these are some of the photographs. And what we have, government schemes are also there. Apart from everything is given free of cost, still we are having the Ayushman Bharat Yojana, which is called health insurance for 70 years and above people. There is a special scheme by the government of India, which is the health insurance scheme for the 70 years and above, up to 5 lakh rupees of treatment. Because certain treatment, like for example, cancer is there is a chemotherapy, or there is some costly medicines, there are costly investigations. So that will be covered in this scheme, which is called as the Swasthya Suraksha Yojana and Family Welfare Scheme. So like these schemes are also, there are multiple schemes by the government of India. Even for the pregnant woman, for the delivery, everything is given free of cost. And over and above, they will give some amount of money also. Some currency also will be given to the mother to take care in the home. Understand? So like this schemes are there for the government. Okay. So this is all about healthcare delivery system. Now the next component, we are giving nursing trade in India. How the nursing trade is there in India? What is there? What are the opportunities for the nursing? What are the challenges of the nursing? So that we have to see. Since we are from the nursing profession, we should see. Our time.
Yes.
Okay. So what is nursing? We have around 13 lakh nurses. Means how much million? 1.3 million nurses in India. And what you see, we have around our ratio, doctor to population ratio is given by the WHO is 1 to 1,000. 1 doctor to 1,000 population is given by the World Health Organization. But actual in India, we have only 0.48 per 1,000 population. Doctors ratio. And nurse to population ratio is given by the World Health Organization is 3 nurse to 1,000 population. Given by the WHO. But in actual, we have 1.96 to 1,000 population. Still, we have a 2.4 million beds shortage. Still in India, 2.4 million beds are shortage. This, The government wanted to establish hospital, but there is no doctors and no nurses. So that is what the shortage of the nurses. So there we have to work out on that, because see this 1.96 we have raised now in the last 5 years. Before 5 years it was 1.3. Now there is a large expansion has made in the India, and we have now reached to the 1.96. And since our population is increasing, so that is the big challenges in the government sector. Understand? So we have to see the evolution of the nursing practice, then how the nursing can improve the healthcare services. So first one is the adoption of technology in nursing. Means we have to adapt the technology. We have to use technology like a computers, like artificial intelligence, like a machine learning. So that might be helping the people, because see earlier if any patient goes for the investigation, it was requiring 4 to 5 days to get the report. Understand? But now if you investigate today, by the evening you will get all the reports. That is because of the technology. Understand? Patient monitoring system in the hospital, we don't have to go every time to the patient and check for the temperature, check for the pulse, check for the electrocardiograph. Not necessary, because nowadays there are lot of electronic spades are available, and it shows on the monitor what is the pulse, what is the temperature, what is the blood pressure. Understand? So it is the technology which has helped the nursing professionals. Understand? So integration of technology into nursing practice improve the efficiency and the patient care. Understand? So that is the innovation such as electronic health records. Because nowadays you must have seen in the hotels, if you give the order in the hotel, so rice or dal, whatever it is, then it reaches to the kitchen. Like that information is table number so and so. Like this, even in India also, we are planning for the nurses. They should have some device. They can feed the data of the patient. It will go directly to the central, to the expert, to the doctors. Understand? And they can give the orders, what is happening to that patient. Understand? Even certain times there is a telemedicine. Even the telephonic electrocardiograph. If you call some number, your electrocardiograph will be graphed in the doctor's cabin, and that doctor will call you back. You have having some problem. Is need not to go to the doctors and see. Understand? So that is all because of the technology. Understand? So then another component is the quality assurance in nursing. So nursing must have the high quality nursing services. Everything, whatever we are doing, we have to have a quality, so that there should not be any error in the because a lot of patients are dying because of the medication errors. Across the world, 1 million patients must be suffering from this medication error. Some sort of in the doses or in the calculations or in the reading the that drugs. So that might happen. So we have to maintain the quality. Understand? So it is a mechanism and implemented ensure nursing practices meet established standards. So we have to increase the standards so people will be trusting on the nurses. Understand? So that quality assurance has to be there in the nursing services. Then continuing education and research. So the nurses must updating their knowledge continuously. They should not be deprived of the knowledge. Any updates which comes, new drugs is coming up, new investigation is coming up, so new diseases are coming up. So nurses must be aware of the whatever the things are happening in the continuous education and the research. So all the practices should be based on the evidence-based nursing practices. Understand? There should be some evidences. Understand? So whatever the researches are conducted by the nurses for the patients or for the families, so that has to be disseminated to the people. Understand? So this disseminated to the nursing professionals. So that has to be there. Okay, so this is what the summary. So what takeaway from this presentation? So presentation highlighted the importance of the healthcare delivery system in India, how we are working from the central to the state to the local level. In the local level also there is a community health center, there are primary health center, there are subsectors. Understand? So that entire population will be covered by the health services. Understand? And the health services are given by the two types. One is the public sector and one is the private sector. Understand? Public sector is the free of cost, private sector is with cost. Understand? And future vision of the healthcare delivery system. So everybody will get the accessible and affordable health services. Accessible means easily approachable services, and affordable means it should be either free of cost or the minimum cost. Even the private hospitals are also there is a control of the government on the cost, how much cost has to be there. Understand? So in India there is one good initiative which is happened. It is called as a generic drugs. Generic drugs is very cheaper drugs. If one medicine costs $10, then in the generic it will be $2. So that much of difference is there. So it is a services to the poor people. So this is what. And what are the current challenges in the healthcare? So what are the challenges? Where are the disparities? So there is a disparity in the healthcare access, quality and infrastructure remains a challenge, because what happened? The services are there, but crowd of the people are more. So that everybody will not get that much of services. So, and we cannot expand the hospital because there are shortage of the nurses and doctors. Understand? So that is the challenges. Okay. Then opportunities. What are the opportunities? So enhancing public health awareness, employing digital health technologies. So we have a good opportunity to inculcate the technology, inculcate the digitalization. Understand? So that it will be helping to the people. So the community is strengthening the community health programs to improve overall health outcome in India. So everybody's health should be improved. Health status should be improved, and our health systems will be better in the world. And India has really improved a lot, because every year 5 million patients across the globe comes to India for the treatment. That is called as a medical tourism. That is also happened in India, because all these corporate hospitals, they have launched that medical tourism. Even there are some agencies are there which can help, because the cost of the healthcare services in India is very low compared to the developed countries. Understand? So if suppose if any operation, if you are spending $10,000 in USA or UK, that cost will come down to maybe 25% only in India. Understand? So that's what the 5 million patients are traveling to India for the treatment. And we have a lot of systems, indigenous system. People don't want nowadays this modern medicine, because it creates the side effects. So people are going for the herbal medicines, Ayurveda, Unani, Siddha system. So that is helping. Even the cancers are cured by the Ayurvedas. Understand? So there are a lot of evidences. There are a lot of research has conducted. And this indigenous system of medicine, which is there in India, which is very helpful, and so the people are traveling. It's not for the modern medicine, but for the this indigenous medicine. So that is what which is happening. So now we just a cut short. I have, I think, 5-10 minutes. So whether you understood the topic or not, so we have certain few questions. So can anybody answer? This NITI Ayog is emerged as central authority, planners, think tank, and team of advisors. First slide, I explained in the first slide how the NITI Ayog, NITI, National Institute of Transforming India, Planning Commission. It is a planning commission of India. So it is emerged as, yes, anybody, anyone, yes. Yes, see, think tank. It is a think tank. It is an intellectual people have come together and they have made the NITI Ayog. Understand? For the planning of the India. Understand? So answer is think tank. Okay. The health system in India has how many links? Yes. Yes, correct. 3 is correct. Because it is a central, state, and local or peripheral. These are the 3 links. Okay. A typical primary health center covers dash population in hilly, tribal, and difficult area. Primary health center, remember, for the plain area is different, and for the hilly, tribal, and difficult area. I told you there are 3 components: community health, primary health, and sub-center. Sub-center covers 5,000 and 3,000. Primary health center covers for the plain area 30,000, and for the hilly area 20,000. Okay. 3-tier system in India is village panchayat, panchayati raj, gram panchayat, and panchayat samiti. Yes. Yes. Panchayati raj. Okay. Thank you.
Can we get this presentation?
Yes.
So that we can
Yeah. Yes. Yes.